little bit. Ann?
All right, thanks, Erin. Now, the Trump administration is planning a major announcement next week to address what it's calling a national crisis of opioid misuse. And it is a staggering problem. In fact, since 1999, the number of American overdose deaths involving opioids has quadrupled, 33,000 people in 2015 alone. But how is this problem going to be tackled while at the same time doctors are working to treat patients with chronic pain? I had the chance to speak with Dr. Scott Irvine at Integrated Pain Associates in Killeen about the latest developments he is seeing.
We now have the insurance companies which are making changes. This past week, Cigna had made the announcement that they were no longer going to allow for their patients to get OxyContin at all. They wanted to have an abuse deterrent, which is all good and well. And again, I understand the impetus of that, the thrust of that, the spirit of that. But at the same time, we don't even know if our local pharmacies carry that specific drug. We don't even know what the copay is going to be. We don't know whether it's in the supply chain with regard to being able to move those patients over. And again, the difficulty is that those patients don't get called. We wind up having to mine our own charts to find out the Cigna patients, to find out who's on that medication. And so it creates this avalanche of work that's unanticipated, but yet needs to be done. And this is happening every single solitary day.
But there's something that is in the works now on the national level. It's something called a call for a change.
Yes.
Explain that whole situation.
So the call for a change is taking the opposite position. And I don't want to say opposite as in they're trying to maintain the status quo as it applies to narcotics. What they're trying to do is say there needs to be a measured response, a judicious application of narcotics to patients, because there is a role. There are patients that have had 2 and 3 and 4 back surgeries. They haven't worked. They've gone through a significant trauma and they have chronic pain as it applies to a lower limb. They have had a great knee surgery and they're anatomically 100% correct, but they have chronic pain. So there is a place for that, but we need to maintain safety and adherence or compliance to the best standards of practice. So what they've done is they've said, look guys, let's put the brakes on and everybody stop, the right hand's doing this, the left hand's doing that, the executive branch is doing this, the enforcement branches are doing that, the local divisions are saying, let's stop and let's create a quorum of individuals to talk our way to the same spot, but not do it in a cowboy fashion. So they're actually starting a national campaign. They're lobbying Congress. They're lobbying everybody to just put the brakes on just a second. We're not saying we don't need to change, but it doesn't need to happen, as you said last time, in a draconian fashion.
And so you are going to be a part of that discussion. You'll be going to D.C., is that right?
Yes, we're going to go to D.C. and speak to congressmen and senators and try to get their ear, because a lot of times patients don't know what we even do. I still today get patients that come in the office and have no earthly idea what a pain physician is. They'll say, why am I here and what do you do? Well, I would presume that the same thing applies to the people that are making the laws. They're well intended, but again, we're at the pointy end of the stick. We actually see the patients, and so some of the things that go on with regard to applying the outcomes of those things really can't happen in a fashion that allows us to still deliver care. So we're going to go out in December and try and talk to some of the senators and raise the awareness. There's so many things that everybody needs to learn about what pain management is, and that it's not just going to the pharmacy. That's the punchline.
And we will continue to follow closely the opioid crisis and the response to it.